623, 49 degrees. Welcome back to Daybreak. Doing more with less. The Southcentral Foundation's Nuka system of care has caught the attention of healthcare leaders around the world.
It's received recognition for its success in health outcomes, efficiency, and satisfaction. It's also the focus at a conference happening tomorrow in Anchorage. The goal is for healthcare leaders to take what's working up here and implement it into their own programs in the lower 48. Joining us on the couch to explain, Dr. David Labby, former Chief Medical Officer of Health Share of Oregon, and Casey Cooper, the Chief Executive Officer of Cherokee Indian Hospital. Good morning.
Good morning.
Thanks for being here. The Nuka system of care, what is it?
Well, the Nuka system of care, I would say, has sort of three elements. One is they start with the notion that making the community healthy is really their job. And if you think about most healthcare systems, they think about what kind of health services can we deliver? How many surgeries can we do? How many visits can we get? So they start with a totally different premise, and they've done, which is how do we get the members of our community to be healthier? And they really focus on being really good medically technically, but they also focus on developing their own workforce, and most of all, really focusing on what the people who come to them for care really need in relationship. They talk a lot about relationship rather than services. It's walking together with people to know where they want to go, where they've come from, and how they can help them be healthy. So that's the essence of it.
So have you implemented elements of this model into your respective organizations?
So we started studying Southcentral Foundation in 2012 after they won a Malcolm Baldrige Award. It was becoming obvious that they were becoming the health system of the future for this country. So we brought governance and leadership to Anchorage. We studied, we analyzed their systems and their processes. We were sold. So we went home to North Carolina, and we tore down walls and started redesigning our clinic space. We redesigned our systems and our processes, and we immediately implemented the multidisciplinary integrated care teams like they have. And then the next phase for us was to change the culture, a culture that's more relationship-based, because the quality of the care that patients receive is a function of the relationship that they have with their care team. So we started working on culture, and then we built a $85 million replacement facility that was completely designed around these systems and processes.
Wow. And what have you learned by implementing some of these methods?
So what we learned is we were actually very affirmed in the things that we already suspect, that relationship matters, right? And when patients feel like they're simply a flow unit moving through a linear system, there's no relationship, there's very little influence and a lot of frustration, and patients frequently have to navigate between many different systems. And then when they have bad outcomes, the professional system just says that they're non-compliant, when in fact they don't have the ability to get through these systems appropriately. So what we learned is that if you redesign the systems and you wrap the systems and processes around the individual patient, then you can improve outcomes, you can improve, most importantly, patient engagement in their own healthcare journey. And I would propose that there's no better predictor of the health of communities in the future than individual engagement, right? That's what we're after.
All right, so the conference going on Thursday and Friday, tell us a little bit about it.
Well, the conference will cover basically all the things that Southcentral is doing, but more importantly, sort of how they think about healthcare. I mean, they are leaders, as Casey said, in sort of changing the way we think about healthcare. Mostly we've thought about healthcare as something that a system sells to people. We get paid on a fee-for-service basis. We do a knee surgery, we get paid for that. So the whole idea of really understanding what is going on with the patient population and the individuals we serve, that's the thing I think we'll all take away. And a lot of us sort of have said over the years, you know, this Southcentral Foundation, it's Alaska native, it's up in Alaska, nobody can really reproduce it, it's a special system. I think what we've learned over the last years, and we've been coming up here since 2005, that's not true. The fundamentals of changing healthcare, which is really engaging with individuals, really understanding their story, is basic truth of health. That's how health works. And if we're going to take costs down, engaging individuals is what's going to lower cost.
Dr. Lappy, Casey, thank you for your time.
Thank you.